I'm Dr. Joseph Sacco. I want to tell you a little bit about the part of the Albany Med Fellowship Program that occurs at the Stratton VA Medical Center across the street from AMC. Our fellowship director insists that I tell you that I come from a technological background which influences the way I teach and my emphasis on things like pathophysiology. I did go to an engineering school at MIT before I went to medical school and arrived in Albany, where I never left. So I've been here for quite a while as part of the full-time faculty. The VA program here we like to think of as being very complementary to the experience that our fellows get at Albany Med. We have a number of faculty members. We have 4.5 full-time people assigned, as well as ancillary help with our NP and PA, along with our technical staff and the others involved with day-to-day care at our VA Medical Center. Now, a number of you have had experiences at the VA, and you know that it's a little bit different in terms of how things go. We do have a VA that looks very large on the outside. The inpatient service is gotten relatively small over time, so we run a consultative service. We do not run an independent cardiology service. As a consequence, we get a lot of interaction with the rest of the medical staff and residents who are working in the intensive care unit, on the medical wards, consulting on the surgical wards, psychiatry, and that sort of thing. A lot of our experience is in the outpatient arena as well. So we are a relatively speaking full service program that has advanced interventions. We do dialysis. We have a full scale of cardiac services, although our cardiac cath lab is currently in hiatus. We certainly look forward to that coming back to full activity. We do nuclear and regular stress testing, full boat of echocardiography, device implants and services, follow-ups, and that sort of thing. So there are 2 fellows at any one time on rotation at the VA. They will share both inpatient services primarily, as well as 1 day a week in our outpatient longitudinal follow-up clinic. We also have 2 of our fellows who come to a consultative clinic on a regular basis every week, and that they stay for an extended period of time, so they get to also do some longitudinal follow-up of patients they see. But they will spend 6 months at a time on that particular clinical rotation. All of our fellows rotate at the VA. It's one of the standard rotations, so everybody gets that experience. Now, one of the things that, or some of the things that are different at the VA, we like to have it's a little less intensive in terms of the patient volume. We like to think we try and make it a little more intensive in terms of spending time on each case, thinking through the pathophysiology, having an opportunity to discuss the fine points of patient management. But as many of you who've had VA experiences in the past know, part of our idea is to give you more emphasis on making the decisions rather than saying, well, the attending told me to do this. The attending, in our case, we expect to say, what do you want to do with this patient? Why do you want to do that? This is another thing you could do. What are the pluses and minuses of each of those kinds of aspects? So you get to be more in control of the patient management and to make some of those decisions, but we also expect you to justify what you want to do. The VA is a unique kind of environment. Folks who have been in military service are intrinsically very dedicated. The VA has an unusual level of success, for example, in recruiting people to clinical studies. We present studies to the patients who say, this may not do me any good, but I'm expanding medical knowledge. I think that's part of the attitude for many of our patients. We do serve a large catchment area, so we also are involved with new telemedicine, video and virtual care technologies, which the fellows have an opportunity to participate in. So we see a broad spectrum of patients and diseases. Many of our patients are older, but we also have a lot of young veterans who've come up through the more recent conflicts and service, including women veterans. We have our own women's veterans program, and you will not see only men anymore when you're on VA rotation. We think this is really a complementary part of the experience, and we look forward to having you come and serve with us. Thank you.